Are you dealing with erectile dysfunction? I'm Dr. Jones, DC with Colorado Medical Solutions, and I'm going to talk to you about these revolutionary therapies that exist to treat erectile dysfunction. Erectile dysfunction is one of those things that affects men in levels that are extremely higher than what most of us think. And we treat and have a really heavy part of our practice with erectile dysfunction, and men come in all the time. And this is such an intimate topic because it affects us men on so many levels. First of all, it's extremely difficult to talk about. It's embarrassing. We may or may not have supportive partners. And currently right now in the medical community, there really isn't many options. You go to your doctor with ED or erectile dysfunction and all they want to give you is a prescription of Viagra. And many of our patients come in where they're either at the point where Viagra is not even working anymore because, again, Viagra doesn't treat the problem, it just masks the symptoms while the underlying problems are getting worse, and we're going to talk about the underlying problems here in a second. But secondly, some patients want to get off the medication or they never want to use it at all because they understand the big picture of healthcare and don't want to be stuck and contingent upon these medications. But the side effects of Viagra are awful. Intracranial pressure, blindness, some tinnitus and headaches and migraines can result from Viagra. It's a very, very powerful dilator of the blood vessels, and so it gets the job done for some people, but it comes at a cost and a toll to our body. And most of my patients know that here at Colorado Medical, we're all about reducing prescriptions, preventing surgeries, and restoring optimal health. Now, how do we fix ED? Erectile dysfunction is a two-part problem. Number one, it starts with blood flow. And the reason why there's a lack of blood flow is from two components: the increase of plaque development in the blood vessels, as well as the lack of healthy blood vessels in the penis to begin with. So we want to hit both with two, and we do hit both with two very powerful therapies. The first therapy is called shockwave therapy. You may have heard this name that's been buzzing around the market called Gainswave. That's exactly what shockwave therapy is. The medical term is extracorporeal shockwave therapy. And what that therapy is in a nutshell is modified sound waves that are administered to the penis to break up the plaques and allow those blood vessels that exist in the penis to have better blood flow. We talked about blood flow earlier. The second powerful therapy that works in conjunction with shockwave therapy is called the P-shot. Now, the P-shot was invented and really just developed by Charles Runnels, brilliant medical doctor who had the ingenuity and, quite frankly, the braveness to figure out that, hey, if we inject some PRP into the penis, it's going to help develop blood vessels. What exactly is PRP? That stands for platelet-rich plasma. Essentially, we draw your blood, spin it out, we pull out all the growth factors and all the goodies, and we isolate that and we inject it into your penis. Don't worry, I've had the procedure done myself just to be able to tell my patients and tell my men, we numb it really well. It doesn't hurt. It doesn't hurt at all. So the P-shot is administered so that we can help support healthy development of new blood vessels in combination with the shockwave therapy to break up the plaques. And now you have, hands down, the most powerful option that you can find to treat this horrible issue that we call erectile dysfunction. So again, if this is bothering you, if this is plaguing you, whether it's full-blown, you can't use it at all, or it's just starting to become a problem, call this number, get in the clinic, let's set up a consultation, and let's see what we can do to get this problem fixed, get you back into a healthy relationship and an active sexual life, because we all know how important that is. This is Dr. Jones, DC, checking out, and I look forward to seeing you guys in the clinic.